Hey everyone, welcome back, exam detectives. Harshal here, and we are officially diving into part 92 of our 100-part CPC exam explainer series. Before we crack open today's cases, you know the drill. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, let's get right to work. So, quick question for you. Do you actually know how to code a 25-minute hydration session? I'll give you a hint. It is a massive trap. Today, we're decoding those really complex, non-surgical medicine section rules under strict, timed CPC exam conditions. We're going to dissect 4 high-yield case studies that literally trip people up all the time on test day. And we're kicking things off with one of the most rule-heavy areas out there.
All right, let's just dive right into it. Case Study 1, the injection and infusion hierarchy.
Okay, so here is our very first clinical crime scene. Imagine a patient receives a 45-minute IV therapeutic drug infusion of ondansetron. Then that's followed by a quick IV push for pain medication, and finally some normal saline hydration that runs for exactly 25 minutes. Let's map this whole thing out. Point 1, right, is the 45-minute therapeutic infusion. Point 2 is that instant IV push. And point 3 is the 25-minute saline hydration. Now look really closely at the CPC exam trap hiding right there at point 3. Because that normal saline ran strictly under the 31-minute threshold, you absolutely cannot bill it separately. No way. So, the absolute crucial point here is understanding the CPT hierarchy. Remember, chemo beats therapeutic and therapeutic beats hydration. It's like a giant puzzle. Based on this hierarchy, our therapeutic infusion takes primary priority, and that's code 96365. Then, the IV push gets reported as a secondary sequential IV push under 96375. And what about that 25-minute hydration? Well, you guessed it, it's not billed at all. Moving right along to case study 2, EKG component splitting. You know cardiology questions love to test exactly who did what. So, who actually gets billed when these diagnostic tasks are divided up? This is a perfect illustration of the component split. Let's look at scenario A. Here, a private cardiologist only dictates the written report, but they don't actually own the equipment in the outpatient hospital. That is just the professional component, so we report 93010 only. Now contrast that with scenario B, where an independent diagnostic testing facility performs the tracing, but there's no physician interpretation. That's the technical component, so you'd only use code 93005. But wait, what if we throw a scenario C into the mix? Let's say the physician actually owns the treadmill equipment, supervises the cardiac stress test, and writes the final interpretation report. In that case, you've got the whole shebang. You must use the global complete code 93015. If they do it all, don't you dare split those codes. Next up, we have case study 3, the physical medicine 15-minute rule. All right, here is our next scenario. A physical therapist applies a hot pack for 10 minutes and then follows that up with 25 minutes of direct one-on-one therapeutic exercise. You really have to spot the key difference here so you avoid double counting your minutes. A supervised modality, like that 9701 hot pack, is billed exactly once. It doesn't matter how long it takes. But therapeutic exercise, code 97110, well, that's a time-based code requiring strict time rules. So let's break down how you actually do this time-based math. Step 1, we note the 25 minutes of therapeutic exercise. Step 2, we apply the 15-minute standard rule, or the CMS 8-minute rule, where anything from 15 to 29 minutes equals 2 units. Which leads us to step 3. We successfully bill 2 units of service for code 97110. Simple as that. And that brings us to case study 4, vaccines and psychotherapy. Honestly, exam writers absolutely love testing these specific thresholds and dual coding rules. Let's look at scenario A. A 25-year-old comes in and gets a flu shot. The key exam mindset you need to have here is that the product code does not equal the administration code. Since our patient is over 18, we skip the pediatric counseling codes. Instead, we have to dual code. We need an administration code, like 90471, plus a specific vaccine products code, like 90756. Always dual code your vaccines. Now for scenario B, which involves psychiatry. If a patient receives a 30-minute individual psychotherapy session, you've got to verify that time bracket. Code 90832 strictly requires the session to hit that 16 to 37-minute threshold. And since 30 minutes falls perfectly inside that window, 90832 is our exact match.
Boom, we have cracked all 4 cases. Let's quickly wrap up by cementing these high-yield rules with our masterclass cheat sheet.
Seriously, take a screenshot of this right now. You've got to remember your infusion hierarchies. Chemo beats therapeutic, which beats hydration. And always watch out for that 31-minute hydration trap. Make sure you know your EKG global complete codes versus component splitting. Remember that supervised modalities in physical medicine are billed once, while therapeutic exercises are time-based in 15-minute units. And finally, say it with me, always dual code your vaccines. Idmin plus product every single time. Well, that brings us to the end of part 92. But before you head off to study, ask yourself this one provocative question. Do you truly know how to code temporary versus permanent HCPCS equipment? I mean, are you absolutely sure? Join me next time for part 93, where we're going to decode HCPCS Level 2 guidelines, the structure, those tricky temporary versus permanent codes, modifiers, and all things durable medical equipment. Keep decoding, and I'll see you there.